to see Huntington disease. In Huntington disease, the patient presents with cognitive impairment, could be dementia, or just some abnormalities on the personality of the patient, and movement disorders. These movement disorders are usually increased movement, like chorea, but also athetosis, that is the snake-like slow movement of the fingers. The patient could have depression as the cognitive part. Here the diagnosis, we would do a CT scan or MRI that will see the decrease in the volume of the caudate nucleus and the putamen, that are the lateral structures to the lateral ventricles. So if we have atrophy of this nucleus because of neuronal loss, then we will see increase in the lateral ventricles size. This is the characteristic thing seen on an MRI or CT scan. Now, Huntington disease results from a triple repetition code. This is CAG. This is cytosine, adenosine, guanosine. A lot of this kind of triples is going to produce Huntington disease. Usually it is hereditary, but at the time patients are diagnosed with that, they already have children, and so it will be more difficult. The confirmatory test is with the DNA analysis, genetic testing, and the treatment for Huntington could be either deutetrabenazine or reserpine. Both of these decreases the incorporation of dopamine into the vesicles of the synaptic cleft, and so there could be no release of dopamine, so we decrease the movement fluctuation of these patients. So cognitive impairment, you could say C of caudate nucleus, A of adenosine, and G of the patient has decreased GABA and decreased acetylcholine because it's losing the pons cells that the putamen cells that has these neurotransmitters.